Today we're going to be talking about Chapter 32, which is infertility. And when we review this chapter, I want you to really consider the role of the nurse. Rather than fixating on the types of procedures and the instrumentation used for couples going through infertility, I really want you to kind of think about the role of the nurse, especially in supporting couples and partners who are going through infertility. So when we think about infertility, we always want to look at it from both ends of the spectrum, both the male and the female factor. So for male factor, some things that could impact fertility include abnormalities of the sperm, erections, ejaculation, as well as abnormalities of the seminal fluid. And we can see some of those abnormalities in the sperm itself pictured in slide 3. For the women, we want to think about disorders of ovulation, any abnormalities of the fallopian tube, so the organs used to help release the egg, as well as any abnormalities of the cervix, which would help, just to review, that any abnormalities of the cervix, which would help maintain the pregnancy inside the uterus. We want to consider women who've experienced repeated pregnancy loss. We want to think about, is there any abnormalities in the chromosomes of the zygote or the fetus itself? Like we stated before, is there any abnormalities of the cervix or the uterus, structures used to maintain the pregnancy? Is that why there is continued pregnancy lost? Are there any endocrine or hormonal abnormalities that really kind of push the reason for a pregnancy loss? Any immunological factors, environmental agents that might be teratogenic that these patients are exposed to, or any history of infections. On slide 7, we just have a visualization of some abnormalities of both the uterus and the fallopian tubes that could impact a patient's ability to gestate and maintain a pregnancy. In the evaluation of infertility, when patients first come in to see a healthcare provider, they talk about that preconception counseling. They review a patient's history and physical examination. They talk about diagnostic testing for both the female and male partners, as well as review of therapies to facilitate pregnancy. And they might consider medications to induce ovulation. Continuation, they might talk about surgical procedures, therapeutic insemination, egg donation, and surrogate parenting as options to have patients kind of review as part of that infertility workup. In evaluating infertility, they might consider assisted reproductive technology. This is that in vitro fertilization where healthcare providers, physicians specifically, isolate the sperm and they isolate the egg through surgical procedures. And they can create a zygote in either kind of like a test tube type of setting to initiate for transfer, or a more developed embryo, depending on the infertility and depending on what would be best for the patient themselves. And we can see some of that, both removal from the ovary there and implantation of the embryos in the uterus there in slides 11 of 17. And we also get a nice view of that on slide 12 of 17 here. You can see that needle guide is used to attach to the top of the ultrasound probe, and that's kind of how they are able to isolate that egg from the ovary there in this patient. After interventions have been considered for infertility, we also want to assess the response of the interventions. We want to discuss any kind of awareness or any problems that might have caused the infertility, and we want to aid our patients in seeking help for infertility if that is their choice to do so. Reactions during evaluation and treatment can really influence a couple's decision making. We want to consider the patient as a whole person, that holistic care. What influences their decision making? Are there social issues, cultural, religious values? Is there any of that can really impact a couple's ability to choose infertility treatment? We also want them to consider financial factors as well. Infertility treatments may be covered by insurance, they may not, so it's important that patients really consider that financial aspect as well. When we're caring for our patients, we really want to consider that psychological impact or reaction that infertility might have for them. Guilt, feelings of isolation, depression, stress on the relationship, especially influenced by themselves, social media, culture, family, and other religious values as well. If couples are choosing for infertility treatments, we also want to think about outcomes. Pregnancy loss after infertility therapy is something we might want to discuss or review with our patients as a possibility. Or parenthood after infertility therapy. How is this journey through infertility and treatments impact the way they parent? And for some patients who infertility treatments have not worked for them, definitely considering adoption and reviewing their options for parenthood there. We want to think about the application of the nursing process when we care for couples who are going through infertility. Assessment, nursing diagnoses, we talked about a lot of the kind of like that grief role that they go through. So we really want to make sure that we're hitting on the psychological risk factors for them. We want to discuss expected outcomes, especially when we're reviewing infertility treatments with them, discuss any nursing-led interventions, and really the evaluation of how those interventions went with our patient.